Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio today warns that while urgent care is growing in popularity and may be fine for patients with issues that are simple, urgent care centers can actually delay care for those patients who may have more complex health issues. And he also says that many times urgent care centers act as kind of a triage center, treating the pressing symptom at the time, but referring patients back to their primary care physician for a thorough review of their symptoms and a proper diagnosis. He's here with us today to talk about adult children caring for parents and overseeing for their medical care and how concierge medicine can help those folks. How are you doing today, Wayne?
I'm doing fine, Neal.
Thank you. Thank you so much for returning. Now, Wayne Lipton, you've got more than 35 years of experience in healthcare. Could you talk a little bit about your background and about concierge choice physicians as well?
Well, it started in just after college. I got involved in family business of pharmacies. In the early 90s, my brother and I, a doctor in Connecticut, built an IPA and a physician management company, and we helped doctors to realize the equivalent of what is an ACO today in risk contracting. Very, very early versions of the models that are being built today. In the early 2001, 2002, I worked with a large company in concierge care, and I said to them that I thought it would be a good idea to consider a partial model of concierge care. Mm-hmm. They weren't particularly interested in that, but I thought it was a great solution, and so I founded Concierge Choice Physicians, dedicated to offering a variety of approaches to concierge care, including a partial model, which I then called hybrid, and it's now become the term to describe doctors and practices that offer a part of their time in the concierge mode.
What kind of feedback have you gotten from physicians who've transitioned, say, totally into concierge? Is this something that they do before they decide to totally go into concierge, or is this partial time, one way or the other, something that you can do from now on? Or is, how does that work? Is it a choice or is it a transition?
Well, we're called concierge choice for a variety of reasons, and I think it's not just the choice of the patients, but the choice of the doctors too. For some doctors, they either can't move into a full model because it's inconsistent with what their business goals are or their professional goals. It may be that their patient base could not support enough people in a concierge model to make that work. It may be that the doctor just doesn't have the heart to say goodbye to people that they've known for many, many years. So about 90% of the practices we have as clients are in a hybrid model, and some of them ultimately gravitate to a full model, and some never gravitate. We have hybrid models that have been in practice now for 10 years, and we have full models that have been in practice for 10 years. So it varies, and the good news is that it's a flexible approach that works not only for primary care doctors, but also some specialists as well in the hybrid approach.
Now, many of us baby boomers are making decisions and plans for taking care of our aging parents, relatives, loved ones, and whatnot. How can concierge medicine come in and divide services to better care for those of us who are going to be taking care of our parents?
Well, I've experienced this myself. In fact, I'm about to move one of my parents into a facility, and I've talked at length with her doctor. I think concierge care is an opportunity for us children who are dealing with our parents' needs to have greater connectivity with the doctor, ease of access, ease of communication, and more time to understand the details, because it's just not easy when you call and leave a message with a nurse and then or a PA or someone in the office, and then you hope for the call back at some point to get a few minutes with the doctor. And also, parents need more time, especially those who are confused or have difficulty to communicate with the doctor. I think that there are instances where people have very fine care in health facilities. If you tend to be at home and are maybe supported by other support providers, other caregivers, then a concierge program really helps people at a distance or even nearby, the families, to communicate. It's well worth the fees involved to have that level of communication to make sure that your loved one is being given the best treatment possible and understand all the complications. Look, it's a very complicated set of issues when you get to certain ages, not just Alzheimer's, but all the mobility issues, all the general health issues. And managing all this can be extremely difficult. So it's not just having somebody on a telephone that takes care of a little care coordination. Being able to talk to the doctor and spend serious time with the doctor, both as the patient and as the child taking care of a parent, I think is very, very important. And actually, I think about 5% or maybe a few more points higher than that of the providers that we work with are geriatricians. And they have a concierge program because they give as much time as they can to all their patients, but some patients are very much interested in more time, and some families are interested in more time, and this is a way to have it available to them.
You were talking about the added fee, it's worth the extra fee. How affordable is concierge medicine, and is there a huge difference between the full concierge model and the hybrid concierge model that you promote?
Well, the fees tend to be the same whether it's full or hybrid, but the fee for the programs vary slightly. I think we encourage a certain range of fees in order to keep the number of people who participate somewhat limited, especially in a hybrid approach, and also to meet the economic needs of giving the time that people really want. So the fees run anywhere from about $1,600 a year, generally to about $2,500 a year. There are some providers that we work with that go even higher than that, upwards of $6,000 or $7,000, but very, very few. We try to encourage a fee structure that's reachable and comfortable for a reasonable percentage of the patient population that the doctor is serving. I think that's an important piece as well.
Is there a significant portion that's paid by Medicare?
Medicare doesn't. No, this is entirely an out-of-pocket cost.
Okay,
it's not a. It is entirely. But the cost of $125 to, let's say, $200 a month, particularly for someone who has some very serious needs, both emotional and medical, can be well worth it. And I think this is consumer-driven healthcare, meaning the consumer decides, do I want this or not? And if the benefits are appealing to the individual, then they can purchase it or not. I think that's one of the big differences between a full model and a hybrid model. The motivation for full models oftentimes is that the patient doesn't want to lose their doctor. But in a hybrid model, the decision is entirely about, do I want the benefit that's available to me? Because I'm going to see the same doctor whether I'm in the traditional side or the concierge side. And the number of people who join is in a hybrid tends to be in the order of anywhere from 50 to 150 members, which may occupy up to about a quarter of the doctor's time. So it's not a very large number. The doctor's practices that we work with vary in size from 1,000 patients to, say, 3,000 patients in their traditional side. So it's a small portion. Again, it's a choice and an opportunity, but it's not for every patient in the hybrid approach.
Could you talk about concierge choice physicians as far as being in the local area? Do you have any outreach, any other offices outside the New York area? And where can we get more information about choice?
Well, we work all over the country. We have practices right now in Hawaii and California and New York and Florida, all over the Midwest, the South. I mean, we're in 23 states and with hundreds of doctors. It's not tens of thousands, but certainly we are the second largest company in concierge services. in the nation.
Wow.
And while we have one office, we have representatives all over the country. So if someone were to want to reach out to us, they could go on our website, which is www.choice.md. They can call our offices at our lines, and you just look up Concierge Choice Physicians on Google or whatever your search engine is, and you'll find us. We're there. We're on call for doctors.
Thank you. Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today talking with Wayne Lipton, founding member and managing partner of Concierge Choice Physicians, and with more than 35 years of experience in healthcare and business, including the past 10 years with Concierge Choice Physicians. He's been here with us talking about how hybrid concierge models of healthcare can support groups and institutions, and also how adult children caring for parents and overseeing their medical care can benefit from concierge medicine. It's been great having you here with us today, Mr. Lipton.
Well, thank you so much, Neal. It's a pleasure having the opportunity.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.